Hello, my name is Tanya McMillan, and I'm a BSN student at Indiana State University. And today my presentation is going to be on hospice care, nursing support. The objectives for this presentation are to define and identify the aspects of hospice, to identify services provided for hospice care, to identify healthcare policies and regulations regarding hospice care, to identify a lifelong learning plan for nursing practice, and to identify diversity issues in hospice care. At this time, please stop the presentation and click the pretest link to test your knowledge concerning hospice care. What is hospice? Hospice is medical care to help someone with a terminal illness live as well as possible for as long as possible, increasing quality of life. Hospice also addresses symptom management, coordination of care, communication, decision-making, and clarification of goals of care. Hospice care is implemented by an interdisciplinary team of professionals who address physical, psychosocial, and spiritual distress focused on both the dying person and their entire family. Hospice care is provided to patients with a life expectancy of 6 months or less. Rather than seeking a cure, its focus aims to make their remaining time as comfortable and as meaningful as possible. This may involve pain relief and nursing care, but also includes emotional support and help with everyday tasks. Services provided for hospice care. There are different services provided for people in hospice care. They include time and services of the care team, to include visits to the patient's location by the hospice physician, nurse, medical social worker, home health aide, and chaplain or spiritual advisor. Medication for symptom control or pain relief, medical equipment like wheelchairs or walkers, and medical supplies like bandages and catheters. It also encompasses physical and occupational therapy, speech language pathology services, dietary counseling, and any other Medicare coverage services needed to manage pain and other symptoms related to the terminal illness as recommended by the hospice team. Also, short-term inpatient care and short-term respite care. And finally, grief and loss counseling for patients and loved ones. Policy and regulations. If you have Medicare Part A, which is hospital insurance, and meet all these conditions, you can get hospice care. The requirements are that your hospice doctor and your regular doctor, if you have one, certify that you're terminally ill with a life expectancy of 6 months or less. Also, you have to accept palliative care for comfort instead of care to cure your illness. And also, you must sign a statement choosing hospice care instead of other Medicare covered benefits to treat your terminal illness and related conditions. The financial aspect of hospice care is the cost for coverage of Medicare. With Medicare, you pay nothing for hospice care, but you may need to pay a co-payment of no more than $5 for each prescription drug or other similar products for pain relief and symptom control while you're at home. In the rare case your drug isn't covered by the hospice benefit, your hospice provider should contact your Medicare drug plan to see if it's covered under Medicare Part D. You may need to pay 5% of the Medicare approved amount for inpatient respite care. Medicare doesn't cover room and board when you get hospice care in your home or another facility where you live, like a nursing home. Lifelong learning. Lifelong learning is an active process in which nurses and other healthcare professionals search for knowledge and understanding and uses it to meet his or her professional lifetime needs. It is obtained through continuing education by integrating knowledge, performance, and competence in the field of health. Lifelong learning methods can be achieved through attending health conferences or seminars, volunteering on health committees, seeking out mentorships, and also continuing education courses. Use of strategies of lifelong learning will lead to increased quality of education, development of nursing competencies, and an increased quality of patient care. Diversity issues in hospice care. Enhanced cultural competencies continue to be a need for hospice nurses and other health professionals caring for terminally ill patients and families of diverse backgrounds. Cultural competencies are cultural desire, cultural awareness, cultural knowledge, cultural skill, cultural collaboration, and cultural encounter. Cultural desire means to see each patient as a unique and worthy person to be treated with dignity, fairness, and deserving of quality of care. Cultural awareness means the process of becoming more sensitive, respectful, and attentive to the patient's cultural beliefs and practices. Cultural knowledge means learning about various cultural groups' beliefs, values, lifestyle practices, and perspectives on life. Cultural skill means the development of interpersonal communication skills that convey respect, appreciation, and sensitivity to other cultures. Cultural collaboration is the development of mutually agreeable goals between the healthcare provider, patient, and family. Cultural encounter means being open to learning, understanding, and appreciating the other person's viewpoint. These competencies are relevant because they impact the patient's reaction to the dying process and the decisions the patients and families make. Trust is the purpose behind cultural competence in the development of the nurse and patient relationship. The references for my presentation today came from www.medicare.gov, hospicefoundation.org, ethnomed.org, and a journal article from Oncology Nursing Forum stating nursing support of home hospice caregivers on the day of patient death. So at this time, if you would please click on the link below to take the post test to see how much you've learned from my presentation. Thanks for watching.